Hello, I'm going to talk a little bit about GBS screening and treatment. I have been doing a lot of research on GBS here lately and realized that the evidence really shows that, or what the evidence shows. Group B streptococcus is a naturally occurring bacteria in the gut. Typically, it occurs in about 20% of people and typically does not cause any problems, but can cause problems with the newborn. In 1 to 2 newborns that are not treated with antibiotics during labor, it can cause early GBS disease and or late GBS disease. Both are very difficult for the infant and need to be treated in a NICU. The late onset can cause meningitis. We universally screen people at 36 to 37 weeks, which consist of taking a swab and doing a vaginal rectal swab. Evidence shows that if you are not instructing people to do it correctly, which both of our labs show that the correct way to do a vaginal rectal swab for GBS is to insert the swab into the vagina about 1 centimeter or 2 and then insert slightly into the rectum. We, at where I work, have not been telling people to do that, and we have a very low GBS rate. So I'm wondering if that might be user error, and I want to bring that up to my preceptor. But we instruct people to just swab around the vagina, kind of around the troitus, and then across the rectum. But from everything that I'm reading, the evidence shows that you really do have to go inside the rectum. Antibiotics during labor is the gold standard for treatment. The risks of taking antibiotics are that the infant's microbiome could be compromised. The infant can have a better chance of having a better microbiome if the baby is born vaginally and breastfed. C-sections tend to have less good bacteria in the microbiome. Taking probiotics is a prophylaxis move to help decrease GBS. This is kind of debatable because in a lot of articles on ACOG, things like that, they say that there's no effect. It's not effective on GBS, but there is a meta-analysis systematic review that I will link in my references that actually shows that taking probiotics from 30 weeks on had a pretty significant decrease in positive GBS people. So from what I'm reading, there is evidence to support that GBS can be affected, can be altered, lowered by the use of probiotics. Things such as like garlic, there's people that will put garlic inside the vagina. That's not necessarily a treatment that's been studied. There's no evidence to support that. And using universal screening plus antibiotics in labor reduces early GBS disease in infants to 0.2 babies per 1,000 babies. So it's quite a significant difference in not doing treatment, not doing the universal screening, which bumps it up to about 1 to 2% of infants will get that early GBS disease. Our lab, we use SonoraQuest and LabCorp. We don't have a rapid test, but we do have, the test comes back typically the next day or 2 days. The most days it would be 3 days. So it's pretty fast turnaround. Where I work, the midwife is a CNM, and she treats GBS with an oral antibiotic, and that's 5 days on, 5 days off. It's typically Keflex if there's no allergies to Keflex, and she treats it 5 days on, 5 days off, 2 weeks prior to the estimated due date and up until the delivery. I cannot find this protocol anywhere on the web on the internet. So because originally I thought it was from AABC, but I cannot find that as a standard protocol anywhere. So I actually have some questions for her. She works at a different clinic on Thursdays and Fridays, so I'm going to actually ask her about that. As far as community births concerned, treating antibiotic during labor, the state laws vary everywhere. In Arizona, I should be able to offer antibiotics during labor, and I'm kind of at an advantage because of where I live. I live 10 minutes to Mexico, and a lot of medications that are not readily available in America are available across the border without prescriptions. So I can actually get medications that maybe I might not necessarily be able to get in America, whether that's ethical or not. It kind of is what it is, but that can be an option. So I think right now my comfortability level would be to offer people antibiotics, and if they decline the screening or the antibiotics, to just really inform them and make sure that they are informed on and educated on their decision and what the risks are, and then what the symptoms of early onset GBS is in babies. Thanks.